Welcome to the Rehab Links Secrets to Success podcast. I'm Lisa Chase, your host, and today I have a special guest with me, Dr. Lisa Valastro, and she is from Regenexx at New Regeneration Orthopedics in Tampa Bay, Florida. Welcome.
Hi, Lisa. Thanks for having me.
This is so great. We recently met, I would say really just this year, right? And we were at a happy hour and, your colleagues with Dr. Torrance, who we also had on the podcast not too long ago. And, you've got a little different background than Dr. Torrance. You are a DO, but you're also a physiatrist and specialize in physical medicine, right?
Yes, exactly.
Yeah.
So we were both in osteopathic medical school. We actually both went to Lake Erie College of Osteopathic Medicine. But yes, I went into physiatry, physical medicine and rehabilitation, which is a little different from Ron's background in family medicine.
Right.
But that was my pathway into getting into musculoskeletal and then ultimately regenerative.
Right. And then you also did a fellowship in sports, spine, and regenerative medicine as well, which is great.
Yes, I did that in Napa, California, which was a great place to live for a year.
Yeah, I saw that.
Yeah, but before that, I knew that I was into musculoskeletal medicine, into non-invasive or non-surgical orthopedics and helping those conditions. But it wasn't until I did that fellowship that I really understood what regenerative medicine was all about and really developed a passion for it out there. And then it was fortuitous that I ended up in this group here in Tampa by actually a patient of mine in California who was a friend of one of the doctors I work with now here in Tampa and knew I was moving to Tampa. So that's how I ended up with this group.
Wow, that was lucky because it is a great group of doctors. And just, I just think the philosophy and everything is, I just love it, compared to having to go the surgical route. Oftentimes there's so many of these other options that many people don't know about. So before we jump into that, let's just talk a little bit about, more about kind of your journey and how, you got to where you are today.
Yeah, so my interest in medicine probably started as a kid, just being so curious about how the body worked. It's really fascinating, all the things it can do. I mean, just think about when you're cooking pasta on the stove and you're stirring the pasta and you feel the vibration of the noodle hitting the spoon, hitting the handle, and you can tell just by stirring approximately how cooked that pasta is.
Yes.
It's just fascinating. I always thought, how does that work? How can we do these things? So I knew from an early age that I wanted to go to medical school simply because I wanted to know. I wanted to know how the body worked. So that is what propelled me into medicine. And then I knew that the musculoskeletal system was my favorite after taking physics in high school and just loving the angles of the muscles, the shapes of the joints, and how that can pull you in different directions. And learning how the body could move became what led me into musculoskeletal medicine. And typically, I think people who have a more surface level knowledge of medical specialties think about immediately orthopedic surgery when they hear musculoskeletal. Yes. So that's where I first drew my interest, and I first started to rotate and get some experience looking at that. And of course, I loved it. It was so cool being in the operating room, seeing all of the changes that they could do. But then I had an experience of my own, actually, where I had a hip injury just from overuse and running, and went to my primary care physician. Classically, they sent me to an orthopedic surgeon, and we did a steroid injection. They did an MRI, and the surgeon told me, you probably have a labral tear. I don't see it on the MRI, but it misses about 15% of them. So let's just do a surgery anyway. And I was 20 at the time. I had no idea and no reason not to. I just wanted to feel better. So I ended up doing that. And I didn't feel any different afterward.
Wow.
Very disappointed. Yeah. And then I just, I continued to do my own thing and try to work around my pain and exercise how I could. And then fast forward a couple years later, I'm shadowing a bunch of specialties before medical school to kind of hone my interests and just get more experience. And I literally looked in the white pages. It shows you how long ago that was, just looking
Right.
for different, or maybe it was the yellow pages. I don't even know how it works anymore, but looking at different doctors' offices, and I came across Adirondack Rehabilitation. I didn't even know what PM&R was at the time, but it was something different. I had already done ortho, cardiology, family medicine. So I called them and I asked if they'd take a student to shadow for a couple of days. And so I met these two brothers who have this private practice doing PM&R. And I actually still am great friends with them now, which it's
Awesome.
so fortunate how you meet people on this path.
Yes.
But just casually in between patients, we were talking about my issues that just happened to come up, my hip pain and the journey that I've been through. So one of them was, he just said, come on the table, let me take a look. And he thought, maybe it's your psoas muscle. And no one had ever brought that to my attention before.
Mhm.
And I mean, he did a thorough physical exam. It wasn't anything crazy, but it was just outside thinking that no one had ever done. And then the more that I watched him practice and his brother practice and just see the way that they looked at patients, got me more interested in PM&R, because musculoskeletal medicine is not just orthopedics, the joints and doing surgery on the joints.
Right.
The muscular system is complex, the way the nerves innervate the muscles, it's all a lot more than I had been exposed to before.
Yes.
And the more then that I shadowed in the two specialties, because it took me a while, orthopedic surgery, PM&R, to kind of decide, the more I saw people experience what I had experienced, kind of being rushed into surgery without giving their body a chance to rehab on its own. And after I had that experience in that PM&R clinic, I then on my own decided to aggressively rehabilitate my hip. I worked on hip flexor strengthening and got back to running on my own. And I'm sure that the surgery was not necessary after going through that. So that experience, and then just seeing others experience that same thing, made me try to shy away from surgery when possible.
Right.
One of the big tenets of osteopathic medicine also is that the body has the ability to heal, defend, repair itself. And the more I went through medical school and we learned about that, the more I believed in it and the more I felt like rehab medicine, so helping people functionally get back to where they want to be, the more that resonated with me. So that's how I got into PM&R.
Yeah, that's such a great story. I think, when we have that personal experience, and, unfortunately, you ended up having to go through a surgery, to kind of come to that revelation. But now, hopefully you can prevent a lot more, other people not having the surgery. And I love, the osteopathic background, where it's really looking at, the whole system and figuring out, okay, what are the muscles where there's the problem, what nerves are innervating, and what could be either inhibiting or overdriving these muscles. And then, from there, it's, clean up some of the mechanics. And then, what I want to hear next is, okay, so now you're doing regenerative medicine, right? You're doing these different types of injections like PRP and bone marrow. So I'd love for you to talk a little bit about that. Were you exposed to that out in Napa? And that's what kind of drew your interest into this group, or how did that come about?
When I initially went out to Napa, my goal for going out there was to get better at diagnostic ultrasound. That was my favorite part about residency, was being able to put the probe on somebody and just learn so much about what was going on. And then also using that to do targeted injections. And we were doing steroid injections, prolotherapy injections. We were doing a lot of Botox injections for spasticity in residency. There wasn't anyone doing PRP in residency, but I had heard from a former resident in my program who did the fellowship out in California that there was so much ultrasound, and they do a lot of PRP and some bone marrow, but regardless of what you're injecting, it's ultrasound, you're going to get a lot of probe time, your skills are going to get better. So I said, oh, I don't know that much about PRP or stem cells, but I really want to get better at ultrasound. So let's go. And then the journey in Napa was a long, or how do I say this? It was a steep learning curve to learn all about platelets and bone marrow and everything it can do. But my mentor out there, he's not with Regenexx, but does a lot of very similar things. And he was a very experimental attending. So he liked to see what was going on with patients and figure out if there was a way that orthobiologics could help. So there are lots of studies out there for PRP and what it can do for things like elbow tendonitis and knee osteoarthritis. But he liked to think outside of the box and think about other ways that platelets could help or stem cells could help. And so I think he was a great person to learn from because he was constantly doing research. He had a research assistant and a lab person that would come once a month, and they would talk about ideas, and they would say, okay, I have a patient with this. What do we think? What's the latest research about how, the cells can work in this structure, and what can we do for this patient? And he was just so brilliant about that and constantly working with us to tell us how that worked, to teach us how to best utilize it for our patients out there. So yeah, I think that seeing how well it worked, both in the standard cases, so tendinopathies and knee arthritis, like I was saying, and also these almost experimental things that he was trying to get people to feel better in any way possible. Right. I was just amazed at what it could do. And I felt that if I practiced medicine and I didn't include that, I was doing a disservice to patients and a disservice to myself, because it was what I was finding I was most passionate about. Now, there's so many negative side effects of steroid injections and radiofrequency ablations and other things that you can find in the classic pain management practice. But really just positive things were coming out of platelets and stem cells. I mean, they weren't the 100% pain relief solution for everybody, but they were so much healthier and people were getting mind-blowing results, in my opinion. So I felt like if I could help someone heal with their body's potential for healing and harvest that and augment what their body can do on its own, it's really speaking to my passion. It's healthy for them. And I think that's the wave of the future for medicine, or at least it should be.
Yeah, absolutely. Well, I'd love for you to, because some of the listeners may not, have heard of PRP or bone marrow. So can you just touch on what are these different types of injections, and how are you using them to help the body heal?
PRP to start, I'll start with that one.
Yeah.
Naturally in our body, we have components for healing. We get an injury, such as a cut on our arm, the blood flows to the area, platelets get there first. They are responsible for grabbing that tissue, pulling it back together, reorganizing the collagen there. They also send out signaling molecules, these growth factors and cytokines, and that stimulates increased blood flow to the area and repair cells to come in and help bridge that gap. When we have an injury in other areas of the body, sometimes we don't get good enough blood flow for that repair to happen. Or sometimes the repair partially happens, but it's not complete and we still have residual pain. When we're using PRP, we're creating that from the platelets that we have in our body. So we do a blood draw, we spin it down, and we concentrate those platelets that are naturally in the blood to very, very high levels. Then we use ultrasound and we use X-ray to guide those platelets right into an area that we have injury and that we need help healing. So those platelets are getting there by our needle, and they're a much higher concentration to do what they need to do. It's almost like giving the body extra fuel to do what it already knows how to do.
Right.
The difference with stem cells is subtle. So we are still harvesting them from our body. So when we're taking stem cells, how we do it in our practice, we take bone marrow from the pelvic bones and the low back. And again, we concentrate them. So there are those healing factors, those growth factors, those cytokines in the bone marrow. And there are also stem cells. So they're mesenchymal stem cells that help stimulate growth of bone, cartilage, tendon, ligament. So by using that, it's a little bit more potent when we're asking for a bigger repair to happen, such as a large rotator cuff tear or a ACL tear. But we're still utilizing cells that would naturally be making that repair, just concentrating them and delivering them where they're needed.
So when there's an injury that's more involved, like severe arthritis, or, you know, maybe a more significant ACL ligament tear, then you may choose to use more bone marrow than PRP.
Yes, so if we have a large tear in a tendon, bone marrow is what we're shooting for, or a ligament issue like an ACL that has been torn. Bone marrow is really what we need. Platelets are great though for more mild things like a tendinopathy, wear and tear of a tendon. We also use platelets a lot around the spine when we're trying to get, we're trying to reduce inflammation around nerve roots. We're trying to make more space in the spine. We're not asking for regrowth of tissue in that area. We're trying to actually open it up and just have things heal. So there are different body structures and different severities to injuries that might warrant platelets, or bone marrow might warrant a different preparation of the platelets. And it's all kind of an art, because one injury might be multifactorial. So you might have an ACL tear, but also have some significant arthritis going on at the same time, and maybe a sprain of your MCL at the same time. So when we're dealing with a body part, we look at all the different structures and what might best respond, and then tailoring our treatment so that we're doing the best concentration in the best regions.
Yeah, and I really appreciate that about, you know, you and your group, because I feel like, you know, you use that diagnostic ultrasound and your experience to really evaluate the situation and then figure out. Sometimes it's a combination. You know, I've seen Dr. Torrance, you know, utilizing stem cells and fat for more like certain muscle tears, and then pairing that with the PRP. So, you know, you guys, you know, have such great experience in that area, seeing that that is like predominantly, you know, what, you know, the practice, you know, focuses on. So that's where I feel super confident, you know, sending somebody to you guys to help really discern and make that diagnosis and figure out, like, what are they a candidate? And if so, what's going to be the best combination to give them the best outcomes?
That's what we're passionate about.
Yeah, awesome. Well, I know that you also specialize in spine. So I was curious about epidurals, right? So a lot of people that have back pain, that they may have like radiculopathy, pain down the leg, you know, they're not able, maybe not quite a surgical candidate yet. They're having therapy, but maybe not getting the response that they'd like. And oftentimes it is recommended that they go have an epidural. But can you talk to how maybe instead of doing an epidural with steroids, are there procedures that where you can be using these different type of injectables that may get a better outcome?
Yes, typically in the spine, we're having great results with platelets, especially for a situation like you described. So if you have a patient that has a herniated disc, that disc is putting pressure on a nerve root, which is causing pain, numbness, tingling down the leg. What we want is to reduce that pressure on that nerve root to reduce those symptoms. And I just had a conversation with a patient about this maybe 3 hours ago. So steroid injections, they are anti-inflammatory. So they'll reduce that inflammatory response for a period of time when they're injected into the epidural space in that region. And generally they do work for people, but for a short period of time. Reducing inflammation is great for pain, but it doesn't change necessarily the structure. So the best way to completely relieve that pain is to heal the disc. So that bulge that's happened, we want that to heal. We want that to go back in. So we want the disc to have better integrity and back to how it was. What we do that's different from steroid is platelet lysate. And platelet lysate is similar to PRP. It is just frozen and then filtered. And we process it that way because it is healthier around nerve tissue. And we're immediately delivering growth factors around that disc that has that bulge to encourage healing, to encourage that bulge to reduce. And then the growth factors are also deposited around that nerve root to reduce the pain from the nerve root, to help heal that tissue as well. And the goal is so that it's one injection and it's a permanent healing and fix of the solution. Compare that to steroid injections, where people are usually getting a series and they're becoming less and less effective over time. It's because they're not fixing anything. But with the platelets, instead, we're healing the disc and we're healing the nerve root that's irritated.
Right, which I love, because so many physicians I know prescribe more the epidural, but since, working with your group, I know that there are other options for patients, and, we know the effects that steroids can have on the body. So it's good to know that that's another option and that you're seeing really good outcomes with that.
We are. And when we're treating an issue like that, we don't just treat around that disc and the nerve roots. We're also treating the facet joints, the muscles and the supporting ligaments in the spine, because we recognize that the spine is a unit. And if there is imbalance or abnormal structure in one part of that unit, it's going to affect the other parts of the unit. So we know that a disc that's become squished a little bit is putting more pressure on the joints behind it. So we know that the entire spine unit could benefit from the platelet products. So we tailor them to be, it's platelet lysate maybe around the disc and different concentrations of PRP into the joints and the ligaments, but we treat the spine as a whole, because that is the best way for patients to have a complete healing of the area.
Yeah, that's great. And I've seen that with my patients. They've done really, really well. So let's get into your kind of top 3 tips on how you get great clinical outcomes.
One of the things I find most helpful in this field in particular is drawing on your network of colleagues. Regenerative medicine is so new. There is always new research coming out. There's no textbook of this is how you do it for this injury. So you can have the best training possible. You can have gone to the best schools, the best residency, fellowship, but all you have is your own experience. And if you can draw on the experiences of your colleagues and ask them about certain cases and what they've seen and what they've experienced and what their outcomes might have been if they've tried certain treatment protocols, I think that's a lot more helpful, because you are then treating the patient with your own expertise and your experience and also the experience of others. So I have a group chat with the other doctors I work with in this practice. I have one with the other fellows that I did fellowship with my co-residents. I know certain people that I've worked with see a lot of feet. Certain people see a lot of carpal tunnel. So I'm always picking their brains, and they're picking my brain too. And I think that having that large network of people who do similar things, have similar mindsets, but maybe have experienced other things in practice, and you can learn from them. I think that's hugely beneficial, especially when there's not a specific algorithm to follow with what you're doing.
Absolutely. That is so true. And we can't be experts in everything, right? We know what we're good at. And then you surround yourself either with a team that you work directly with, or like you said, a network that you can reach out to. I mean, I've reached out to Ron on many of times, texting him and going, well, okay, I have this patient. What do you think? So it's really great to have that network. I agree.
Definitely. The second thing I think is important is just to have integrity in your decision-making and to really do the right thing.
Yeah.
There is something I think about often in my past. So I've, of course, trained with a bunch of different people to get to where I am now. And in a clinic where you see people who have pain, it's a very common thing to have a pain diagram. So you have a little cartoon of a human, and the patient takes it and puts a little X where they have pain. And I have 2 experiences in my mind. One, I was working with a clinician who looked at the paper, saw that there was so many X's just all over the body. And his response when he looked at that was, see this? This chart is the gift that keeps on giving. Thinking in his mind, oh, I can charge this patient for injecting their shoulder, their hip, their knee, their back. And I mean, he has a private practice. He's worried about that, of course, but I just felt a little icky inside when he said that. And then a couple years later, I'm working with another attending. He sees a very similar pain diagram, X's all over the body. And he says to me, you know, Lisa, when you see a diagram like this, it doesn't mean there's something wrong with every part. There's usually one structure that's causing all of these other symptoms. And that just, you know, the feeling you get inside when it's good versus evil.
Yes.
I just felt like, okay, that resonates with me and that feels good. And that feels like the right way to look at this patient.
Yes.
And both of these people, they both own their practice. They both are successful in their practice, but the latter, he always treated his patients that way, trying to figure out what was the problem and what can I do for you that's best for you. And it might not be that he charges them for 17 injections, but he gets them feeling better and it's in a more respectful way. And I think because of that, that's how his reputation developed.
Absolutely.
And that is then how his business grows. And I think that if you pay attention to doing the right thing and doing the best thing for the patient and not worrying about keeping the lights on and getting everybody paid, it all works out in the end because patients do better and then they tell their friends that they're doing better and they tell their friends how well that this person treated them.
Absolutely. I think that, you know, more clinicians should have that high integrity for sure, whether they're cash-based or they're insurance-based. I think you can get entangled in that very easily. And so I think, you know, having the integrity of doing the right thing and trying to do what's in the best interest of the patient is always going to get you better outcomes.
Definitely. The last one, cheesy, but I think very important, is just being kind to everybody.
Yeah.
So being kind to your patients when they come in, that's the first way that you're going to start to make them feel better. You're nice to them, they relax, they start to feel better. Because they're relaxed, they might tell you more information than they otherwise would have been holding back if they were stressed and uncomfortable in an appointment.
Yeah.
Being kind to the people that you work with. So I like to be kind to everyone I work with just because it's who I am, but I also find that it's working better for our team. So if people are respecting each other, we're communicating well, then they feel comfortable asking questions about the way things are going in a procedure room or letting me know if something's not exactly how we planned in a procedure, and keeping that open communication and not getting angry when things veer off course ends up where things go better in the procedure and patients have better outcomes because the procedure went well, we were nice to them, the staff member felt good in the room and they were nice to them. They overall, the patients just have a better experience.
Yeah, I mean, you know, kindness and just, you know, showing that you care, whether it's through a smile, you know, just asking how their day is, just remembering their name, right? These are the little things that, especially in medicine and, you know, today more than ever, I feel like, you know, we're going in the wrong direction in healthcare where people don't feel heard and cared for. And so to have more practitioners like yourself that are, you know, that are really giving that kind of care, it makes a difference, you know, even if, you know, maybe what you have might not be what they need, you know, listening to them and helping to figure out where would be the next place that, you know, that you could refer them to where they could get the best care and the best outcomes, I think is really very important. So I like that one. Good. Okay. So is there anything else of value that you would like to share with the listeners, that you would like them to know about you, about your approach, about the techniques and things that you're using to help patients and to help clinicians, if clinicians are not exposed to this, to know like maybe when to refer to somebody like yourself in your group?
I think it's important to remember that health is an investment. It's hard to convince people sometimes to consider our treatment approach because it's something new and different. It's something that insurance isn't covering quite yet. So sometimes patients want to just go with the standard of care, go with what they've done before, go on that same well-being path, if you want to call it that. And same with people who are referring. So referring clinicians say, well, this is what we've always done, and maybe we should just keep doing it this way. But it doesn't, just because something's covered by insurance doesn't mean it's the right way to go. I want them to understand that in our practice, being what we are, we have the freedom to take time with patients and really listen to them and dig into what's going on. We spend an hour with each new patient, and that is listening to them, examining them, using the ultrasound to figure out really what is the problem. I don't think patients get that experience in very many offices.
No.
And then our treatment protocol is very comprehensive, and we are not going to do just one injection and see how they do. We're trying to target everything that's going on. And it's different from steroid, yes, and it's something that may be foreign to a lot of people, but I want people to know that Regenexx is backed by a lot of research and years of tracking patients, and we're doing things based on what that is telling us and based on what is best and what's giving the best outcomes for patients. So if they are going to come and see someone from Regenexx, from our practice at Regeneration Orthopedics, they're going to get that thorough examination, that time spent with them, really pinpointing a diagnosis. And then if they choose to do a regenerative procedure, it's one that's going to be backed by all the latest research, backed by a network of physicians in Regenexx who are all sharing information about their experiences. And it's going to be a product that is top of the line. So we didn't talk that much about that, but our lab, we do very specific concentrations. Everything is manually mixed, meaning we can tailor it to be exactly what we want. And I think that is done in probably less than 10%, maybe less than 5% of clinics around the world are able to do that with their PRP and their bone marrow treatments. So it's really getting the best option when it comes to regenerative medicine. Sometimes surgery is appropriate, and sometimes patients are looking for that and hoping for that. And that's okay. But I think a lot of people want to avoid surgery when they can. And orthobiologics and regenerative medicine really gives them that option. So just coming and meeting with us and talking to us to see what it is and see what the alternative is a good idea.
Yeah, for sure. And that's what I always say. And I always feel completely confident, sending my patients to you guys, because you do take that time. You do an ultrasound. You really try to target what the specific structure or structures are that are involved. And then you give a comprehensive plan, and then you work with us and their therapy, to get them, back to what, they want to be doing and getting them out of pain. So I've always had a really positive experience. And if I'm looking for, hey, I just am not able to get this patient back to where they need to be, I know I can always rely on you guys to help, sort that out. So I really appreciate that. You mentioned just about Regenexx, and I think it is important because, I have a lot of patients that will say, oh, I went to my doctor and he's going to do, he's an orthopedic, surgeon, and he does PRP. And I know, not all PRP is created equally. So could you just speak to the Regenexx standard and how and what you need to go through to become a Regenexx physician and their standards?
To become a Regenexx physician, you have to do a lot of training in medicine residency and then procedural training. Before I was signed on with Regenexx, I had this multiple page packet where I had to fill out a chart. How many of each procedure have I done? And then it had to be under review. There is training through the Regenexx headquarters in Colorado to get people up to speed with all the new advanced things that we're doing. I had to take extra courses before I started on with our team. So just being a physician and being trained in all of the procedures that we do, there are a lot of steps to that. Outside of that is our lab processing team. So we're not even doing that. We have people who are specifically trained to process the products that we're making. In a lot of other clinics, like orthopedic clinics, they have kits that make their PRP. So they draw blood, same amount, put it through the centrifuge, and it spits out your PRP with the same concentration every time. We tailor our concentrations. Like we were talking about earlier, different concentrations work better for different structures. And we're able to do that with our specialized lab team. So they can take the blood that they take what we're asking for. So we tell them we want this many cc's of this concentration, and so on and so forth. They calculate how much blood they need. They spin it down at a certain speed, certain amount of times to concentrate it. So then we can get very specific products for what we're trying to inject. That is extremely rare. So not all PRP is created equal, and obviously bone marrow either. The other difference with us, especially in new regeneration orthopedics, is that this is what we do.
Yep.
We're not surgeons who are doing PRP once in a while if someone's interested in it. We are doing regenerative medicine day in and day out. We are spending our off time reading about the latest studies so that we're doing it the best way possible. If you want really the best regenerative medicine, you need to go to a Regenexx provider.
Yeah, I couldn't agree more, because I certainly see the outcomes of those that have gone, with you guys versus, gone, to a doctor maybe that's not doing it on, such a regular basis, that's not associated with Regenexx, and there definitely is a difference. So I appreciate that you guys are, working so closely with us and with our patients, and that, we've seen such great results. So, well, excellent.
Yeah, well, we are very lucky to have you guys in the community and a very comprehensive physical therapy experience that is not anywhere else. So we are lucky to work with you guys as well.
Well, it is a team effort, like you said. I mean, having partners in the community that can work together and do what's best for our patients to get them, as we say, back to normal is always the goal. So, well, this has been great. I've learned even more about you. So I so appreciate you taking time out of your busy day to share your insight and educate our listeners more about these great interventions. So thank you so much, and until next time, keep getting great outcomes.
Thanks, Lisa.